Management of patients with this particular subtype of colorectal cancer can be difficult because of how aggressive the cancer can be. We're fortunate that we now have regimens that are giving responses for patients. The activity that we've seen in patients getting treated with the binimetinib, encorafenib, cetuximab regimen have been encouraging. And I think what we've seen are patients that can respond, tumors respond, can have improvement in their symptoms. And I think importantly, increased durability of their disease control, more so than we have seen previously. And that certainly provides hope that this is a regimen that can ultimately result in kind of approval and availability for our patients. Obviously, we'll have to wait for the phase 3 study to read out, but we are encouraged that the FDA has recognized this regimen with a breakthrough designation last fall. So they'll be rapidly reviewing the data as that becomes available. So for managing patients with BRAF-V600, in particular with the encorafenib, binimetinib, cetuximab regimen, it does require monitoring for eye toxicities. There can be with the binimetinib a kind of transient blurred vision after dosing, but that usually resolves fairly rapidly within an hour or less of the dosing. But working with an ophthalmologist is sometimes needed if those symptoms become more problematic. Overall, the regimen is well tolerated. It is a regimen that really has very limited skin toxicities because of the blunted feedback pathways. So it's the rare scenario where the triplet is less toxic for the skin than individual agents alone. And that, I think, provides benefit for patients.